Welcome to Walnut Medical Services Visionaire Oxygen Concentrator demonstration. This is a 5-liter concentrator for our oxygen patients here at Walnut Medical Services. Your on and off switch is right here. You push the button, the alarm will sound for a few seconds and it's going to shut off. As you can see, the orange ball over here increases up to 5 liters. This will return to whatever setting you had it originally set for. This is what your doctor orders for you, so that is the liter flow that you cannot go above or below depending on what your doctor has prescribed for you. The O2 alarm light is right here. It's a yellow light that will come on for a few minutes when the machine's first turned on. It's nothing to worry about. That just is on until the machine gets warmed up. Once the machine is warmed up and up to the proper oxygen percentage, that yellow light will turn off and the machine will be running as it's supposed to at that point in time. Above the on and off switch, there's a white button right here. That's a reset button that works like the circuit breaker in your home. So if the power goes out while your machine is running, it of course will turn off the machine, and a lot of times it will kick this breaker on the machine as a safety feature. If that happens, when the power comes back on, turn your machine off, just push that button back in and turn your machine back on and the machine should start back up. If it doesn't, please give us a call at 814-533-0901 for immediate attention. The knob over here is your liter flow control. As I mentioned at the start, this goes from 1 to 5 liters per minute, and this is something that is prescribed by your doctor, and you must use the liter flow that the doctor has prescribed for you. If he orders you 2 liters per minute, you will turn this knob until the orange ball splits the 2 on the dial. Okay, that is right through here. Like I said, you must maintain the proper liter flow because too much oxygen is not good for you, just as well as too little oxygen it has the same result. You do not want to go above or below. You must maintain the proper liter flow as prescribed. Okay. The oxygen comes out the spout right here. You can hear the little bit of air coming out. This machine does not have any filters. They're all internal, so there's nothing that the patient has to clean on a weekly basis or anything like that. The machine kind of self-sufficient in that regard. Okay. If this machine shuts down and stops working at any point in time during the day or night, our phone number and sticker are listed at the very top. Please give us a call. We have 24-hour service, 7 days a week. So that even after we're open Monday through Friday, 8:30 to 5. So anything after hours or on the weekend, there's always somebody available to call and have there to assist you with whatever problems you might be having. Okay, now you want to connect your oxygen tubing to your concentrator. Every setup gets 2 20-foot tubings, a 7-foot nasal cannula, which is here, 2 swivel connectors to connect your tubing and your cannulas, and a humidifier bottle, which we'll go over in a minute. Okay. So what you do is you take one end of your tubing, and that's going to connect to the spout on the concentrator. Just going to make sure you push it on there snug. You're going to find the other end of your tubing. You're going to take one of your swivel connectors. You're going to push that snugly onto the tubing. And you just grab your other 20-foot section of tubing. You're going to connect that also to your tubing connector. And then the last step is to connect your cannula. So once again, you take your other connector, push that snugly onto your tubing. So now you have 40 foot of oxygen tubing, and we're going to add a 7-foot nasal cannula. Once again, it just connects onto the connector like that. So that gives you 47 feet of tubing with your cannula. That's the max we can put on the oxygen concentrator. If you go more than that, it's going to affect the pressure in the line, and it's going to cause the concentrator to malfunction and not work properly. Okay. So for somebody who's not using a humidifier bottle, which is not recommended for less than 4 liters per minute. So anybody using from 1 to 3 liters per minute, this is how you should be using your oxygen. Okay. On the cannula, there's 2 hooks which will go into your nose. Those should be pointed down when you put them in your nose. So first you're going to put them straight into your nose, then you're going to go up over each ear, like so. And then there's a slide here which will tighten or loosen the cannula on the patient's face. Okay? So you want to make sure that this is snug so it fits comfortably for the patient. Now, as I mentioned before, there's a humidifier bottle. Some patients require the need to have humidification inside their line because of dry air, nosebleeds, things like that. Sometimes the humidifier bottle can help. Like I said, most times it's not recommended if you're less than 4 liters per minute, but I'm going to show you how that will connect now. Where your tubing is connected to the concentrator, you're going to take your tubing off of there. And these machines will have an additional separate piece of tubing with some type of threaded adapter. A lot of them look like this. We have a couple different styles, but the concept is still the same. Okay. So you're going to take this tubing and you're going to connect it to the spout on the concentrator. So now your concentrator looks like this with the spout, with the tubing with the threaded adapter on it. At this point, you're going to take your humidifier bottle, and the top of the humidifier bottle is threaded, and where the threaded connector is, you're just going to attach that onto here and thread it into place. Do not over tighten it, just tighten it till it's snug. Okay. So from there you can take the bottle off, and what you need to do is put distilled water in the bottle. There's a minimum and a maximum line. We recommend just putting it at the minimum line because you need to change this water daily. Do not put new distilled water into the old distilled water. You want to dump this water out every day, put fresh distilled water in it. These bottles should be cleaned every 2 days with soap and water. They should be changed monthly. Okay. Now, a very important part is when you're putting the bottle back together, when you put the lid back on and you screw the bottle on, you want to make sure it's not cross-threaded. If it's cross-threaded, it's not going to let any of the oxygen come through. Okay? And an easy way to test that, what I recommend you do every time you put the bottle on your concentrator, is it's always going to bubble. Okay? The water in here is bubbling now. So whether it's cross-threaded or not cross-threaded, the water is always bubbling because the air is going down through. Okay? If your bottle is connected properly, you should be able to stick your finger on the tip of the bottle, and it's making a, when you block it, you release it, it'll make a hissing sound, like this. Okay? If the bottle is not on properly, or you don't have the adapter screwed in correctly to the top of the bottle, where the wing nut is, you're going to see the water bubble, but you're not going to get any oxygen coming out of the tubing like this, making this sound. So I'm going to demonstrate what happens. So if your bottle's not on tightly, you can see the water still bubbles. When I put my finger on the tip of the bottle, there's no hissing. It's not creating any pressure. So that shows you that before you hook up your tubing, you want to test it this way. Okay? So what you have to do then is just tighten the bottle, and you're back to having the oxygen coming out through the line. Okay? So there's two spots where that could cause you the problems. When you're putting the bottle on, which would be right through here, or at the very top where the wing nut is and the adapter connect off of the tubing. Okay. So once you have the bottle connected, you have tested to make sure the air is coming out. All you have to do is take your 47 feet of tubing and cannula, you're going to stick that onto the spout of the humidifier bottle, and this one goes on the back of the machine. Like that. There's a little strap on the back here. The bottle will sit in the back of the machine like that, and that'll allow your oxygen to come through your hose. Okay. But what's very important is that you make sure that your bottle is not cross-threaded. As I mentioned, the bottle should be changed, cleaned every 2 days, fresh water put in daily, replaced every month. Your tubing, if you're not using a humidifier bottle, can be changed once every 3 months. If you're using a humidifier bottle for humidification, your tubing should be changed every month. Your nasal cannulas should be changed every 2 weeks, regardless of whether you're using a humidifier bottle or not. And once again, we give you extra cannulas at setup, and they just pull apart at the connector. You dispose of that, and then you get a new one, and you stick it back onto your tubing. When you need more supplies, give us a call, and we'll either drop them off when we're in the area or drop them in the mail to you. If you're out and about and you're near one of our locations in downtown Johnstown at 226 Main Street, you can stop in for more supplies there. We have a store located in Richland Township on Scalp Avenue in the Valley Dairy Shopping Complex, and we have a new location in Bedford, right on Route 30, in the Heritage Square Shopping Plaza. So all those locations have tubing, cannulas, humidifier bottles, and all the supplies that you need. Oxygen is a drug, so you must use it as directed by your doctor. Some safety things to worry about or to be on the lookout for is do not smoke with the oxygen in your nose or while you're using it in the home. If family members are smoking with the oxygen, and you're using your oxygen, please ask them to go outside. Majority of the fires that are oxygen related are from patients or family members who are smoking with the oxygen in the home. It's a very dangerous situation, so you want to make sure that you don't do that and you prevent others from doing that around you. Be careful around your stove. Make sure your cannula while you're using it, the tubing, are not dragging across your stove while you're cooking. Another aspect to be careful of is candles in your home, on tables or coffee tables, end tables, those type of things where the tubing can get draped across it and knock the candle on the floor or start to burn the tubing. That's a big risk for fire hazards as well. Also, you want to be on the lookout for open flames like a fireplace, space heaters, things like that. You want to make sure that the oxygen is kept at least 25 feet from those items, and most importantly, do not smoke with your oxygen on. The machine needs to have about 12 inches of space all around it, so do not put it right up against the wall. Make sure there's airflow all around it, because what this machine does, it sucks in room air. Mostly comes from the bottom of the machine up into the machine. Right now we breathe 21% oxygen. What this machine does is it gets rid of the nitrogen, carbon dioxide out of the air and produces at least 90% oxygen that comes out through the tubing. So that's an increase of roughly 70% in the oxygen level, which is what helps the oxygen patient with their breathing and their health. So you want to make sure this is maintained well. Keep a good airflow all around this concentrator to help it perform better. Remember, if you have any questions, our phone number and our stickers are usually on top of the machine here. All you gotta do is give us a call. Like I said, 24-hour service, 7 days a week. Our hours are Monday through Friday, 8:30 to 5. Anything after hours, we have somebody available to help you with whatever situation you may have. Thank you.